Hi, I'm Joe Chili, mornings from 7 to 9 on Buffalo's oldie station, The Big Weck. Joining us today on The Big Weck's Buffalo on the Rise is Jennifer O, who is the owner and patient care coordinator at Q-C Kinetix. How are you today?
Good. I'm excited to be here. Thank you.
Nice to see you here. Tell us a little bit about, first, what is Q-C Kinetix?
Okay. Sure. Q-C Kinetix is a medical clinic, and we offer regenerative therapies to address the root cause of common chronic pain issues. You know, traditional healthcare has addressed pain with painkillers such as opioids and steroids, over-the-counter creams, and then eventually surgery. But what's difficult with some of those therapies is that with drugs, there's a risk for addiction, and also it just masks the pain. It doesn't really address the degeneration. And then with surgery, while it does change the composition of the joint, such as a knee replacement or a hip replacement, there's a lot of inherent risks with surgery. You can have infection, you can have nerve damage, you can have all kinds of complications, maybe further down the line. And then there's always the need for additional surgeries when the knee replacement wears out. With regenerative medicine, we're using your own healing and growth factors to totally change the composition of the joint by growing new tissue and reducing the inflammation. So we're not masking the pain, we're actually addressing the root cause of the pain.
You know, a couple of things that would set me off from the very beginning. When people say the word surgery, automatically I'm like, I don't know about that. And then the other thing, when you talk about medications, all of the different kinds of medications and all of the disclaimers for those.
Right.
You know, you hear, and this may do this, may do this, may do
Right,
this.
all of those possible
death.
side effects, right.
You know what I mean? So what kind of injuries or things do you treat? I mean, I know that people have back pain, you know, people may have neck pain. I mean, all those, you know, looking at the telephone, you know, your phone all of the time, you know, those type of things?
Sure, we treat all areas of the body. The most common areas that we treat include knee pain, hip pain, shoulder pain, elbows, but we also, and lower back, we also treat smaller joints such as wrists, fingers and toes, thumbs, the neck. But overall, a lot of those issues have kind of a chronic inflammation component. So like the itises, osteoarthritis, bursitis, tendinitis. But we treat other conditions as well. Sciatica, it depends, and a lot of people think that they have sciatica, but they might have other issues that feel like sciatica,
so
and we can tease that out to see
you treat like the root cause then, right?
Absolutely. So for example, we could also treat athletes who are young and may have torn their meniscus, or they might have a torn rotator cuff, or they have runner's knee, they have tennis elbow, golfer's elbow, the weekend warrior who's, you know, overexerted themselves. So by intervening fast and early, these young athletes or physically active persons, they can get their inflammation under control and start that healing process right away. The important thing is to prevent scar tissue from forming, because once the scar tissue starts forming, that's the beginning of arthritis.
Oh, really?
Down the line, yes.
You know, so can you prevent arthritis, or can you just put it off?
Well, the thing is that we're actually treating the arthritis, because arthritis is really chronic inflammation that breaks down soft tissue eventually. But we are reducing that inflammation, and we're building up that new cartilage, kind of like a paved road. After a while, too many potholes. Yeah. You kind of have to scrape off that top layer and then put new asphalt. That's kind of exactly what we're doing in that joint space. And
can people have, consult with you, do a free consultation or something like this before they actually have something done?
everybody gets a free consultation because we have to determine if that person is a good candidate for our treatments. Not everybody qualifies for regenerative medicine, and depends on the space and the pain area. Certain areas may be a good, may qualify them, and other pain points may be a different source that is not as receptive to regenerative medicine. So everybody gets a free consultation, but what they will experience is concierge medicine. And what that means is that from the time they have that booked consultation, I reach out and make sure we do an individualized exploration as to what they want out of that consultation. And as soon as we determine that, then when they come in for that consultation, there's no wait time. They'll be able to relax briefly, have a beverage, come in and escorted into an exam room. They get a complete medical consultation with our medical provider, a physician or a nurse practitioner, and then the physician will consult with me to determine, is this candidate a good candidate for regenerative medicine, for one of our protocols? And then we develop an individualized protocol for that patient, for that pain area.
Well, Jennifer, I'm going to tell you, it sounds very promising. Jennifer, thank you. We really appreciate that. For more information and answers to your questions and more, call Q-C Kinetix at 1-877-QCK-BUFF, QCK-BUFF. Or you can go to their website, qckinetix.com/Buffalo. Sponsorship and promotional consideration for the preceding segment was provided by Q-C Kinetix.